Welcome to Birdsy. We move fast in these videos to cover as much ground as possible. If you need more time to think, just hit that pause button before I reveal the answer.
Let's get started with a review of hair care and services. What is the primary purpose of conducting a client consultation before providing a hair care service? Is it A, to advertise additional salon products? B, to determine the client's needs and expectations? C, to speed up the service process? Or D, to avoid using professional terminology? The answer is B, to determine the client's needs and expectations. The main goal of a client consultation is to assess the client's needs, preferences, and hair condition to ensure safe and satisfactory results. This step helps prevent misunderstandings and allows for personalized recommendations. Which of the following is not a recommended practice during a client consultation for hair services? Is it A, asking about the client's lifestyle and maintenance routine? B, reviewing the client's previous chemical treatments? C, skipping the analysis of scalp and hair condition? Or D, discussing possible outcomes and limitations? The answer is C, skipping the analysis of scalp and hair condition. Why this question may seem a bit tricky, the use of not requires careful reading, and all options may sound plausible. Only skipping the analysis of scalp and hair condition is not recommended, as it is essential for safe and effective service. During a consultation, a stylist should always guarantee the exact results the client requests, regardless of hair condition. Is it A, true to ensure client satisfaction? B, only if the client insists? C, yes if the client signs a waiver? Or D, false because hair condition may limit achievable results? The answer is D, false because hair condition may limit achievable results. Why this question may seem a bit tricky, the word always is an absolute, which is rarely correct in professional practice. Stylists should never guarantee results that may not be achievable due to hair limitations. A new client arrives for a color service and mentions a history of allergic reactions to hair dye. What should the stylist do before proceeding with the service? Is it A, conduct a patch test and wait for results? B, proceed with the color service immediately? C, use a different brand without testing? Or D, skip the consultation and start the service? The answer is A, conduct a patch test and wait for results. The stylist must perform a patch test to check for allergic reactions before applying any color, ensuring client safety and compliance with industry standards. During a consultation, a client expresses dissatisfaction with previous haircuts and requests a dramatic change. How should the stylist proceed to ensure the client's expectations are realistic and achievable? Is it A, agree to any request without discussion? B, decline the service immediately? C, show examples and discuss hair type and upkeep? Or D, rely solely on the client's verbal description? The answer is C, show examples and discuss hair type and upkeep. The stylist should use visual aids and discuss the client's hair type and maintenance routine to clarify what is possible, helping set realistic expectations and avoid disappointment.
How'd you do on the first 5 questions? Go ahead and subscribe to Birdsy now and turn your progress into exam day confidence. Ready to jump back in? Let's go.
What is the main reason for analyzing a client's scalp and hair before recommending a treatment or service? Is it A, to speed up the appointment process? B, to avoid using professional products? C, to identify any conditions that may affect the service outcome? Or D, to reduce the cost of the service? The answer is C, to identify any conditions that may affect the service outcome. Analyzing the client's scalp and hair helps the stylist determine the client's hair health, texture, and potential issues, ensuring the recommended service is safe and effective for their specific needs. Which of the following statements is least accurate regarding the importance of documenting client consultation notes after each visit? Is it A, it helps maintain a record of client preferences and allergies? B, it is only necessary if the client requests a copy of their records? C, it can help protect the stylist in case of disputes about services provided? Or D, it supports consistent service and client satisfaction over time? The answer is B. It is only necessary if the client requests a copy of their records. Why this question may seem a bit tricky. All options may sound reasonable, but only one is clearly inaccurate. Accurate documentation is essential for tracking client preferences and safety, not just for marketing or legal protection. During a consultation, a client with visibly oily scalp and dry ends asks for a moisturizing treatment. How should the stylist tailor their recommendation based on this analysis? Is it A, suggest a targeted treatment for dry ends and a balancing shampoo for the scalp? B, apply a deep moisturizing mask to the entire scalp and hair? C, only recommend clarifying shampoo for the oily scalp? Or D, advise skipping any treatment to avoid imbalance? The answer is A, suggest a targeted treatment for dry ends and a balancing shampoo for the scalp. The stylist should recommend a treatment that balances moisture for the dry ends while addressing the oily scalp, rather than applying heavy moisturizers to the entire head to avoid exacerbating scalp oiliness. Tools and equipment. Which tool is primarily used to remove bulk from hair without changing the overall length? Is it A, clippers? B, razor? C, thinning shears? Or D, round brush? The answer is C, thinning shears. Thinning shears are designed to remove excess bulk from hair while maintaining the length, making them essential for blending and texturizing during haircuts. Which of the following is not a recommended method for sanitizing combs and brushes after use in a salon? Is it A, immersing in EPA-registered disinfectant? B, rinsing with hot water only? C, using an autoclave? Or D, cleaning with soap and water before disinfection? The answer is B, rinsing with hot water only. Why this question may seem a bit tricky. The options may all sound like cleaning methods, but only approved disinfectants or autoclaving are acceptable. Using hot water alone does not sanitize tools to the required standard for salon safety.
Have you noticed the code in the bottom corner? The next time you're stumped, take that code to Birdsy AI. You'll get immediate help, complimentary study sessions, and access to hundreds of additional questions. It's the best tool to help you pass with confidence.
All of the following are electrical styling tools except one, which is the exception. Is it A, vent brush? B, flat iron? C, curling wand? Or D, blow dryer? The answer is A, vent brush. Why this question may seem a bit tricky. The question lists common salon tools, but only one is not powered by electricity. Reading carefully is key to avoid assuming all are electrical. During a busy Saturday, Maria accidentally drops her cutting shears on the salon floor before her next client arrives. What is the correct procedure she should follow before using them again? Is it A, wipe the shears with a towel and continue using them? B, clean and disinfect the shears before reuse? C, rinse the shears under cold water only? Or D, use a blow dryer to remove visible debris? The answer is B, clean and disinfect the shears before reuse. Maria must clean and disinfect her shears after dropping them to prevent cross-contamination and ensure client safety, as required by salon sanitation protocols. While performing a blowout on a client with very thick curly hair, Sam notices his round brush is getting tangled and difficult to maneuver. Which adjustment should he make to improve the process? Is it A, switch to a fine-tooth comb? B, use a paddle brush instead? C, reduce the heat setting on the blow dryer? Or D, select a larger round brush for better control? The answer is D. Select a larger round brush for better control. Using a larger round brush is more effective for thick curly hair as it provides better control and reduces tangling during blowouts. Which tool is specifically designed to create uniform curls by wrapping sections of hair around a heated barrel? Is it A, flat iron? B, vent brush? C, curling iron? Or D, sectioning clips? The answer is C, curling iron. Curling irons are heated tools with a cylindrical barrel used to create curls or waves in the hair by wrapping sections around the barrel and applying heat. Which of the following statements about disinfecting salon tools is not accurate? Is it A, tools must be cleaned of debris before disinfection? B, household bleach is always an acceptable disinfectant for all salon tools? C, disinfected tools should be stored in a clean, covered container? Or D, single-use items must be discarded after each client? The answer is B, household bleach is always an acceptable disinfectant for all salon tools. Why this question may seem a bit tricky, the use of negative phrasing and plausible-sounding distractors can mislead test takers. Only EPA-registered disinfectants are approved for salon use. Using household bleach is not always compliant with regulations. During a bridal styling appointment at a client's home, Jordan realizes he forgot his heat-resistant mat for his hot tools. What is the safest alternative action he should take to protect the client's surfaces? Is it A, place a thick, dry towel under the hot tools as a temporary barrier? B, set the hot tools directly on the countertop, monitoring them closely? C, hold the hot tools in hand until they cool down? Or D, place the hot tools on the floor away from the client? The answer is A, place a thick, dry towel under the hot tools as a temporary barrier. Jordan should use a thick, dry towel as a temporary barrier to prevent heat damage to surfaces, ensuring client safety and professionalism. Hair care procedures. What is the primary purpose of using a clarifying shampoo during a hair care procedure? Is it A, to add moisture to dry hair? B, to deposit color onto the hair? C, to remove buildup and impurities? Or D, to seal the hair cuticle after chemical services? The answer is C, to remove buildup and impurities. Clarifying shampoos are formulated to remove product buildup, excess oils, and impurities from the hair and scalp, ensuring a clean foundation for further treatments. Which of the following is not recommended immediately after a chemical relaxer service? Is it A, rinsing thoroughly with warm water? B, applying additional heat to speed up drying? C, using a neutralizing shampoo? Or D, conditioning the hair to restore moisture? The answer is B, applying additional heat to speed up drying. Why this question may seem a bit tricky. The options may all sound like common post-service steps, but only neutralizing the hair immediately is essential. Applying heat or additional chemicals can cause damage right after relaxing. All of the following are appropriate steps during a scalp treatment except: is it A, applying conditioner directly to a broken scalp? B, massaging the scalp gently with fingertips? C, sectioning the hair for even product distribution? Or D, using products suited to the client's scalp condition? The answer is A, applying conditioner directly to a broken scalp. Why this question may seem a bit tricky. The question uses an absolute and asks for an exception, requiring careful reading to avoid selecting a correct step by mistake. During a deep conditioning treatment for a client with coarse curly hair in a busy salon, which step should you take after applying the conditioner and covering the hair with a cap? Is it A, immediately rinse out the conditioner, B, brush the hair to detangle, C, apply a styling product before rinsing, or D, place the client under a hooded dryer for 10 to 15 minutes? The answer is D. Place the client under a hooded dryer for 10 to 15 minutes. After applying conditioner and covering the hair, applying heat helps the product penetrate more effectively, especially for coarse, curly hair.
If you want more than just rapid-fire questions, head over to Birdsy AI. You can take unlimited practice exams and get instant help from your personal AI study partner. It's like having a tutor 24/7. Try it free. You'll find a link in the description.
A client arrives for a haircut with visibly oily hair and mentions using heavy styling products daily. What is the most appropriate first step before proceeding with the haircut? Is it A, begin cutting the hair as is, B, shampoo the hair with a clarifying formula, C, apply a leave-in conditioner, or D, use dry shampoo to absorb oil? The answer is B. Shampoo the hair with a clarifying formula. Washing the hair with a clarifying shampoo removes excess oil and product buildup, ensuring an even and precise haircut. What is the main reason for sectioning the hair before beginning a chemical color application? Is it A, to speed up the drying process, B, to reduce the amount of product needed, C, to ensure even coverage and control during application, or D, to make the hair easier to detangle after coloring? The answer is C, to ensure even coverage and control during application. Sectioning the hair before a chemical color application ensures even distribution of the product, prevents missed spots, and allows for more controlled and efficient application. Which of the following should always be avoided when performing a hair steaming treatment, regardless of hair type? Is it A, using a plastic cap during steaming, B, allowing direct scalp contact with hot steam, C, applying conditioner before steaming, or D, timing the treatment for 10 to 15 minutes? The answer is B, allowing direct scalp contact with hot steam. Why this question may seem a bit tricky, the word always can mislead, as some steps may be skipped for certain hair types, but direct scalp contact with hot steam is universally unsafe and should be avoided to prevent burns. All of the following are recommended when detangling wet hair except: is it A, begin combing at the scalp and work toward the ends, B, use a wide tooth comb, C, apply a leave-in conditioner, or D, work in small sections? The answer is A, begin combing at the scalp and work toward the ends. Why this question may seem a bit tricky, the negative phrasing, except, can cause confusion, and all options may seem plausible, but starting at the scalp increases breakage risk. Hair design and styling. Which tool is most commonly used to create soft waves in medium-length hair during a wet set? Is it A, slat iron, B, round brush, C, comb and fingers, or D, curling wand? The answer is C, comb and fingers. Finger waving is a classic technique for creating soft waves, and it is typically achieved using fingers and a comb, rather than heated tools or rollers. This method is especially popular for medium-length hair in wet sets. What is the primary purpose of backcombing in hair design? Is it A, to smooth the hair surface, B, to add volume and lift, C, to add shine to the hair, or D, to define curls? The answer is B, to add volume and lift. Backcombing is used to create volume and lift at the roots, making the hair appear fuller and supporting various styles that require height or structure. Which of the following is not recommended when styling fine, fragile hair for an updo? Is it A, applying heavy styling products, B, using lightweight mousse, C, securing with bobby pins, or D, gently teasing the roots? The answer is A, applying heavy styling products. Why this question may seem a bit tricky. The options may all sound plausible, but using heavy styling products can weigh down fine hair and make it look limp, which is not recommended for updos. All of the following are essential steps in achieving a long-lasting blowout, except: is it A, sectioning the hair before drying, B, using a heat protectant spray, C, applying conditioner after blow drying, or D, finishing with a cool shot? The answer is C, applying conditioner after blow drying. Why this question may seem a bit tricky. The question uses except, so you must identify the step that does not contribute to a long-lasting blowout, even though all options may seem beneficial. A client with thick, curly hair requests a sleek ponytail for a formal event, and you notice significant frizz after blow drying. What should you do next to achieve a smooth finish? Is it A, apply more mousse and brush the hair, B, use a flat iron to smooth the hair, C, tease the roots for volume, or D, set the hair with rollers? The answer is B, use a flat iron to smooth the hair. To achieve a sleek ponytail, using a flat iron after blow drying will smooth out frizz and help create a polished look, especially for thick, curly hair. Which sectioning technique is most effective for achieving even layers when performing a long layered haircut? Is it A, diagonal sectioning, B, horizontal sectioning, C, vertical sectioning, or D, zigzag sectioning? The answer is C, vertical sectioning. Using vertical sectioning helps maintain balance and consistency throughout the haircut, ensuring that each layer is even and blends smoothly with the others. All of the following are suitable for creating volume at the crown during styling, except: is it A, teasing with a fine-tooth comb, B, flat ironing the roots, C, using volumizing mousse, or D, blow drying with a round brush? The answer is B, flat ironing the roots. Why this question may seem a bit tricky. The question lists several techniques that could plausibly add volume, but only one is not typically used for this purpose, requiring careful reading to avoid a common mistake. Which of the following statements about finger waving is not accurate? Is it A, finger waving is best achieved on dry, coarse hair, B, finger waving lotion helps hold the shape of the waves, C, finger waving creates S-shaped waves in the hair, or D, finger waving was especially popular in the 1920s and 1930s? The answer is A, finger waving is best achieved on dry, coarse hair. Why this question may seem a bit tricky. The question uses a negative phrasing and includes plausible sounding but incorrect information, requiring careful attention to detail. Chemical hair services. Which chemical process is primarily used to permanently change the natural wave pattern of the hair? Is it A, hair coloring, B, deep conditioning, C, permanent waving, or D, thermal straightening? The answer is C, permanent waving. Permanent waving is a chemical process that restructures the hair's natural wave pattern by breaking and reforming disulfide bonds, resulting in pearls or waves that last until the hair grows out or is cut. Which of the following is not a recommended step before applying a chemical relaxer to the hair? Is it A, performing a strand test, B, shampooing the hair immediately before application, C. Analyzing the scalp for abrasions. Or D. Reviewing the client's chemical history. The answer is B. Shampooing the hair immediately before application. Why this question may seem a bit tricky, the negative phrasing and plausible distractors can mislead test takers. Scalp analysis and strand testing are essential, but shampooing immediately before a relaxer is not recommended, as it can cause scalp irritation. All chemical hair lighteners will always produce the same results regardless of the hair's natural color and condition. Is it A. True, because the chemicals are standardized? B. True, if the processing time is the same? C. True, when using professional products only? Or D. False, because hair characteristics affect outcomes? The answer is D. False, because hair characteristics affect outcomes. Why this question may seem a bit tricky, the use of the absolute word always makes this statement false. Hair lightening results vary greatly depending on the hair's natural pigment, porosity, and previous chemical treatments. During a chemical relaxer service, a client named Maria reports a tingling sensation on her scalp after 5 minutes of processing. What is the most appropriate immediate action for the stylist to take? Is it A. Rinse the relaxer out immediately and assess the scalp? B. Continue processing and monitor for increased discomfort? C. Apply a neutralizing shampoo without rinsing first? Or D. Ask the client to wait until the full processing time is complete? The answer is A. Rinse the relaxer out immediately and assess the scalp. The stylist should rinse the relaxer out immediately to prevent chemical burns or further irritation, as any discomfort during processing signals a potential adverse reaction. A client with previously colored hair requests a permanent wave, and the stylist notices uneven porosity throughout the hair. How should the stylist proceed to ensure an even curl pattern? Is it A. Proceed without any additional products? B. Use a stronger waving solution on porous areas? C. Apply a porosity equalizer before the waving solution? Or D. Skip the permanent wave service altogether? The answer is C. Apply a porosity equalizer before the waving solution. Applying a porosity equalizer helps balance the hair's absorption of the waving solution, resulting in a more uniform curl and minimizing damage to porous areas. What is the primary function of a neutralizer in the permanent waving process? Is it A. Soften the hair cuticle? B. Remove excess moisture from the hair? C. Rebuild the hair's disulfide bonds into their new shape? Or D. Add color to the hair shaft? The answer is C. Rebuild the hair's disulfide bonds into their new shape. A neutralizer is used to reform and harden the new bonds in the hair after the waving solution has broken the original bonds. This step is essential to lock in the new curl pattern created during the chemical process. Which of the following statements about chemical hair relaxers is not accurate? Is it A. Sodium hydroxide relaxers are also known as lye relaxers? B. All relaxers are safe to use on hair that has been previously colored with permanent dye? C. Relaxers break the disulfide bonds in the hair structure? Or D. Neutralizing shampoo is used after a relaxer to restore the hair's pH? The answer is B. All relaxers are safe to use on hair that has been previously colored with permanent dye. Why this question may seem a bit tricky, the use of not requires careful reading, and all options may sound plausible. Only one statement is false, so it's important to identify the exception rather than the general rule. Which is least likely to cause uneven results during a chemical hair lightening service? Is it A. Using a timer to monitor processing time? B. Applying lightener to hair with varying porosity? C. Overlapping previously lightened hair? Or D. inconsistent application of product? The answer is A, using a timer to monitor processing time. Why this question may seem a bit tricky. The question asks for the least likely cause, which can be confusing if you focus on what does cause uneven results. It tests your ability to distinguish between common and uncommon factors.
If you want more than just rapid-fire questions, head over to Birdsy AI. You can take unlimited practice exams and get instant help from your personal AI study partner. It's like having a tutor 24/7. Try it free. You'll find a link in the description.
Skincare and services. Which skin type is characterized by visible pores in the T-zone and a tendency to develop both dry and oily areas? Is it A, normal skin, B, combination skin, C, dry skin, or D, oily skin? The answer is B, combination skin. Combination skin features both oily and dry areas, with larger pores typically found in the T-zone. Recognizing this helps professionals recommend appropriate products and treatments for balanced care. During a skin analysis, which factor should not be considered when determining a client's skin type? Is it A, oil production, B, pore size, C, hair color, or D, sensitivity? The answer is C, hair color. Why this question may seem a bit tricky. The question uses a negative phrasing, should not be considered, which can lead to confusion. Only factors directly affecting skin type, such as oil production and pore size, are relevant. Hair color is not. A client arrives for a facial and mentions recent use of prescription retinoids. During the consultation, what is the most appropriate action before proceeding with exfoliation? Is it A, continue with the planned exfoliation treatment, B, apply a stronger exfoliant to enhance results, C, ignore the information and proceed as usual, or D, postpone or modify exfoliation based on the client's medication use? The answer is D, postpone or modify exfoliation based on the client's medication use. Prescription retinoids increase skin sensitivity and risk of irritation. Always ask about recent use and adjust or postpone exfoliation to prevent adverse reactions. During a skin consultation, a teenager with visible acne lesions expresses concern about scarring. How should you address their concerns while planning their treatment? Is it A, explain acne management options and discuss scar prevention strategies, B, recommend aggressive extraction to remove all lesions immediately, C, tell the client that scarring is inevitable with acne, or D, focus only on selling acne products without addressing scarring? The answer is A, explain acne management options and discuss scar prevention strategies. Addressing concerns with empathy and providing education about acne management and scar prevention helps build trust and ensures a safe, effective treatment plan. Skincare tools and equipment. Which tool is specifically designed to extract comedones without causing unnecessary trauma to the skin? Is it A, facial steamer, B, comedone extractor, C, microdermabrasion wand, or D, high-frequency electrode? The answer is B, comedone extractor. A comedone extractor is a specialized tool used to safely remove blackheads and whiteheads with minimal damage to the surrounding skin, making it a staple in professional skincare services. Which of the following skincare tools should never be disinfected with alcohol-based solutions due to risk of damage? Is it A, stainless steel tweezers, B, glass mixing bowls, C, wooden spatulas, or D, plastic extraction loops? The answer is C, wooden spatulas. Why this question may seem a bit tricky. The question uses the word never, and all options are commonly disinfected, but some materials, like wood, can be damaged by alcohol. Wooden spatulas should be discarded, not disinfected with alcohol. All of the following are benefits of using a facial steamer except one. Which is not a benefit? Is it A, exfoliates the skin, B, softens sebum, C, opens pores, or D, increases product absorption? The answer is A, exfoliates the skin. Why this question may seem a bit tricky. The negative phrasing and the inclusion of plausible benefits can mislead test takers. Facial steamers do not exfoliate the skin. They primarily open pores and hydrate. During a facial treatment at a busy spa, a client with sensitive skin reacts to the use of a high-frequency electrode. What is the most appropriate immediate action for the esthetician to take? Is it A, continue the treatment but lower the intensity? B, apply a cooling mask while using the electrode? C, switch to a different electrode attachment? Or D, stop using the high-frequency electrode immediately? The answer is D, stop using the high-frequency electrode immediately. The esthetician should immediately discontinue use of the high-frequency electrode to prevent further irritation or injury. Then, assess the client's skin and provide soothing care as needed. Skin care procedures. Which step is essential before performing any facial skincare procedure to ensure client safety and optimal results? Is it A, applying moisturizer, B, cleansing the skin, C, using a toner, or D, applying sunscreen? The answer is B, cleansing the skin. Cleansing the skin is essential before any facial procedure to remove dirt, oil, and makeup, ensuring the products used during the treatment can penetrate effectively and reducing the risk of irritation or infection. Which of the following is not recommended during the extraction phase of a facial procedure? Is it A, using a comedone extractor, B, applying gentle pressure with gloved fingers, C, using fingernails to squeeze blemishes, or D, prepping the skin with steam? The answer is C, using fingernails to squeeze blemishes. Why this question may seem a bit tricky. The options may all sound like standard facial steps, but only using fingernails for extraction is specifically discouraged due to the risk of skin damage and infection. All of the following are true about chemical exfoliation procedures except: is it A, they help remove dead skin cells, B, patch testing is recommended before use, C, clients may experience mild tingling, or D, they are suitable for use on sunburned skin? The answer is D, they are suitable for use on sunburned skin. Why this question may seem a bit tricky. The phrasing asks for the exception and all options sound plausible, but only the last one is incorrect. Chemical exfoliation should not be performed on sunburned or irritated skin. During a microdermabrasion treatment, a client with sensitive skin begins to experience redness and discomfort. What should the esthetician do next? Is it A, stop the procedure and assess the skin, B, continue the treatment at the same intensity, C, apply a stronger exfoliant, or D, ignore the reaction and finish the session? The answer is A, stop the procedure and assess the skin. The esthetician should immediately stop the procedure to prevent further irritation or damage, then assess the client's skin and provide soothing aftercare as needed. A client arrives for a facial and mentions they're using prescription retinoids. How should the esthetician adjust the skincare procedure? Is it A, proceed with a standard chemical peel, B, increase the intensity of exfoliation, C, use gentle hydrating products and avoid exfoliation, or D, apply a high-frequency device immediately? The answer is C, use gentle hydrating products and avoid exfoliation. The esthetician should avoid aggressive exfoliation or chemical peels as retinolates increase skin sensitivity and risk of irritation or adverse reactions. What is the primary purpose of using a toner during a facial skincare procedure? Is it A, to exfoliate dead skin cells, B, to balance the skin's pH and remove residual cleanser, C, to deeply hydrate the skin, or D, to provide sun protection? The answer is B, to balance the skin's pH and remove residual cleanser. Toners are applied after cleansing to help restore the skin's natural pH balance, remove any remaining impurities, and prepare the skin for further treatment steps such as moisturizing or applying serums. During a facial in a busy spa, a client mentions a mild tingling sensation after the application of an enzyme mask. How should the esthetician respond to ensure client comfort and safety? Is it A, ignore the sensation and continue with the procedure as planned, B, immediately remove the mask and discontinue the facial, C, assess the client's skin, monitor for increased discomfort, and reassure the client while observing closely, or D, apply a stronger exfoliant to enhance results? The answer is C, assess the client's skin, monitor for increased discomfort, and reassure the client while observing closely. A mild tingling is often normal with enzyme masks, but the esthetician should monitor the client closely, check for signs of irritation, and be prepared to remove the mask if discomfort increases. Nail care and services. What is the primary purpose of conducting a nail consultation before providing any nail service? Is it A, to advertise new nail products, B, to evaluate nail health and suitability for services, C, to speed up the appointment process, or D, to select nail polish colors? The answer is B, to evaluate nail health and suitability for services. The main goal of a nail consultation is to assess the client's nail health, identify any contraindications, and determine the most suitable services or products for their needs. Which of the following should not be ignored during a nail analysis, even if the client insists it is normal for them? Is it A, client's preference for nail shape, B, client's history of nail biting, C, visible signs of infection or abnormality, or D, client's choice of nail polish brand? The answer is C, visible signs of infection or abnormality. Why this question may seem a bit tricky. Clients may downplay symptoms, but visible signs of infection or abnormality must always be taken seriously, regardless of client reassurance, to ensure safety and prevent complications. During a consultation, a client at a busy salon mentions she is pregnant and has sensitive skin. What should you focus on when analyzing her nails and recommending services? Is it A, suggesting the latest nail art trends, B, ignoring her sensitivity since it's common, C, recommending only gel polish, or D, assessing for allergies and avoiding harsh chemicals? The answer is D, assessing for allergies and avoiding harsh chemicals. Pregnancy and sensitive skin require extra caution. You should focus on identifying potential allergies, avoiding harsh chemicals, and ensuring all products and procedures are safe for her condition. A new client arrives with discolored nails and requests a manicure at a spa. How should you proceed after completing your nail analysis? Is it A, advise the client to consult a physician before any service, B, proceed with the manicure as requested, C, apply nail polish to cover the discoloration, or D, recommend a moisturizing treatment only? The answer is A, advise the client to consult a physician before any service. If you observe discoloration, you should recommend the client see a healthcare professional before proceeding, as this could indicate a fungal infection or other health issue. Nail tools and equipment. Which tool is specifically designed for pushing back and shaping the cuticle during a manicure service? Is it A, nail buffer, B, cuticle pusher, C, nail clipper, or D, orange wood stick? The answer is B, cuticle pusher. A cuticle pusher is a metal or plastic tool used to gently push back and shape the cuticle, helping to prepare the nail plate for further services. Proper use prevents damage to the nail and surrounding skin. Which of the following is not a reusable tool commonly found in nail care services? Is it A, metal cuticle nipper, B, glass nail file, C, emery board, or D, metal nail file? The answer is C, emery board. Why this question may seem a bit tricky. The options may all sound familiar, but only some are truly reusable. Disposable items like emery boards are single-use, while tools like metal pushers and nippers can be disinfected and reused. All of the following equipment must be disinfected after each client, except: is it A, disposable towels, B, metal cuticle pusher, C, glass dap dish, or D, nail clippers? The answer is A, disposable towels. Why this question may seem a bit tricky, the word all can mislead you into overthinking. Only non-porous, reusable tools and equipment require disinfection. Disposable towels are discarded after use, not disinfected. During a busy afternoon, Maria accidentally drops her metal nail file on the floor while preparing for her next client. What is the correct procedure she should follow before using it again? Is it A, wipe it with a dry towel and continue using it, B, rinse it under water and dry it off, C, spray it with alcohol and use immediately, or D, clean and disinfect it according to salon protocols before reuse? The answer is D, clean and disinfect it according to salon protocols before reuse. Maria must properly clean and disinfect the metal nail file before reuse to prevent cross-contamination and ensure client safety as required by sanitation standards in professional nail care services. Nail care procedures. What is the primary purpose of pushing back the cuticle during a manicure procedure? Is it A, to strengthen the nail plate, B, to expose the nail plate for polish application, C, to increase blood circulation in the fingers, or D, to remove dead skin from the fingertips? The answer is B, to expose the nail plate for polish application. Pushing back the cuticle helps expose the nail plate, allowing for a neater polish application and reducing the risk of hangnails. It also prevents the cuticle from growing onto the nail plate, which can cause damage or infection. Which of the following should never be used to remove nail polish during a basic manicure? Is it A, non-acetone remover, B, acetone remover, C, metal pusher, or D, cotton pad? The answer is C, metal pusher. Why this question may seem a bit tricky. The options may all seem plausible, but only non-acetone and acetone removers are safe for polish removal. Using metal implements can damage the nail plate and is not appropriate for removing polish. During a pedicure, a client mentions they have diabetes and sensitive skin. Which modification should the nail technician make to the exfoliation step? Is it A, use a gentle exfoliant or skip abrasive scrubs, B, increase pressure to remove more dead skin, C, use a metal foot file for deeper exfoliation, or D, apply exfoliant for a longer period? The answer is A, use a gentle exfoliant or skip abrasive scrubs. Clients with diabetes and sensitive skin are at higher risk for injury and infection, so gentle exfoliation or skipping abrasive scrubs is recommended to protect their health and safety. When performing a nail service, which step is always performed immediately before applying polish, regardless of the type of service? Is it A, applying cuticle oil, B, buffing the nail surface, C. Soaking the nails. Or D. Cleansing the nail plate. The answer is D. Cleansing the nail plate. Why this question may seem a bit tricky. The steps in nail services can vary, but cleansing the nail plate to remove oils and debris is always necessary before polish application, even if other steps seem important. A client arrives for a manicure with visible nail fungus on 2 fingers. What is the most appropriate action for the nail technician to take in this situation? Is it A. Proceed with the manicure, but avoid the affected nails? B. Refuse the service and refer the client to a physician? C. Disinfect the affected nails and continue the service? Or D. Apply artificial nails to cover the fungus? The answer is B. Refuse the service and refer the client to a physician. Nail technicians must not perform services on clients with visible nail infections. The client should be referred to a healthcare professional to prevent the spread of infection and comply with safety regulations. What is the recommended method for sanitizing metal nail care tools after each client's service? Is it A. Wiping with a dry towel? B. Rinsing with warm water only? C. Immersing in an EPA-registered disinfectant? Or D. Spraying with air freshener? The answer is C. Immersing in an EPA-registered disinfectant. Metal nail care tools should be thoroughly cleaned and then disinfected using an EPA-registered disinfectant after each client to prevent the spread of infection and maintain proper salon hygiene standards. During a manicure, a client accidentally nicks their cuticle and begins to bleed. What is the most appropriate immediate action for the nail technician to take in this situation? Is it A. Continue the service without interruption? B. Stop the service, put on gloves, and follow blood exposure protocol? C. Ask the client to clean the wound themselves? Or D. Ignore the cut and proceed to polish application? The answer is B. Stop the service, put on gloves, and follow blood exposure protocol. The nail technician should stop the service, put on gloves, and follow proper blood exposure protocol, including cleaning the area and applying a bandage to ensure client safety and prevent cross-contamination.
Have you noticed the code in the bottom corner? The next time you're stumped, take that code to Birdsy AI. You'll get immediate help, complimentary study sessions, and access to hundreds of additional questions. It's the best tool to help you pass with confidence.
Professional practices. Which government agency is primarily responsible for regulating cosmetology licensing and enforcing professional standards in most U.S. states? Is it A. The U.S. Department of Labor? B. The State Board of Cosmetology? C. The Federal Trade Commission? Or D. The American Cosmetology Association? The answer is B. The State Board of Cosmetology. State boards of cosmetology are the main agencies that oversee licensing, set regulations, and enforce professional standards for cosmetologists in most states. Which of the following is not typically required to renew a cosmetology license in most states? Is it A. Payment of a renewal fee? B. Proof of continuing education hours? C. Passing a new practical exam? Or D. Submission of a renewal application? The answer is C. Passing a new practical exam. Why this question may seem a bit tricky. The question uses a negative phrasing, not typically required, which can cause confusion. Most states require fees and continuing education, but do not require a new practical exam for renewal. A cosmetologist who moves to a new state must always retake both written and practical exams to obtain a license there. Is it A. False? B. True? C. Only if the original license is expired? Or D. Only for written exams? The answer is A. False. Why this question may seem a bit tricky. The use of always is an absolute, but many states have reciprocity agreements that may waive some or all exams for licensed professionals. During a routine inspection, a state board inspector finds that Jamie, a licensed cosmetologist, is using products not approved by the board on clients in her salon. What is the most likely immediate consequence Jamie will face? Is it A, Jamie will be required to take additional continuing education courses immediately? B, Jamie will have her license permanently revoked on the spot? C, Jamie will be reported to the local police for criminal prosecution? Or D, Jamie will likely receive a citation or fine from the inspector? The answer is D. Jamie will likely receive a citation or fine from the inspector. Using unapproved products is a violation of state regulations and can result in penalties such as fines, citations, or even temporary suspension of the license. Maria, a newly licensed cosmetologist, is asked by her employer to perform chemical services she has not been trained for. According to professional laws and rules, what should Maria do in this situation? Is it A, attempt the service under supervision? B, refuse to perform the service and inform her employer? C, perform the service if the client signs a waiver? Or D, ask another unlicensed coworker to help? The answer is B, refuse to perform the service and inform her employer. Cosmetologists are legally and ethically required to refuse services they are not trained or licensed to perform, prioritizing client safety and compliance with regulations. What is the primary purpose of state cosmetology licensing laws? Is it A, to increase salon profits? B, to promote new beauty trends? C, to protect public health and safety? Or D, to advertise cosmetology schools? The answer is C, to protect public health and safety. State cosmetology licensing laws are designed to protect public health and safety by ensuring that practitioners meet minimum standards of education and competency before providing services to clients. Which of the following statements about license display requirements in salons is not accurate? Is it A, licenses must be visible to clients at all times? B, licenses must always be posted at the front entrance of the salon? C, individual licenses should be displayed near the workstation? Or D, failure to display a license can result in disciplinary action? The answer is B, licenses must always be posted at the front entrance of the salon. Why this question may seem a bit tricky. The question uses a negative phrasing, not accurate, which can cause confusion. Most states require licenses to be displayed in a visible location, but not all require them to be posted at the front entrance or in a specific frame. During a busy afternoon, Alex, a licensed cosmetologist, is asked by a client to perform a service that is outside the scope of his state-issued license. According to professional laws, what is Alex legally required to do in this situation? Is it A, perform the service if the client insists? B, ask a coworker to supervise and proceed? C, refer the client to an unlicensed friend? Or D, politely decline and explain the legal limitations? The answer is D, politely decline and explain the legal limitations. Cosmetologists are legally required to refuse services that fall outside their licensed scope of practice to avoid violating state laws and risking disciplinary action or license suspension. Ethics and liability. Which of the following best describes the primary purpose of a professional code of ethics in cosmetology? Is it A, to increase business profits? B, to advertise salon services? C, to guide professional conduct and protect clients? Or D, to set product pricing? The answer is C, to guide professional conduct and protect clients. A professional code of ethics in cosmetology serves as a guideline for appropriate behavior, ensuring that practitioners act with integrity, maintain client trust, and uphold industry standards. Which action is least likely to result in liability for a cosmetologist, even if performed unintentionally? Is it A, using unsterilized tools on a client? B, failing to perform a required patch test? C, ignoring a client's allergy disclosure? Or D, following all sanitation protocols as required by law? The answer is D, following all sanitation protocols as required by law. Why this question may seem a bit tricky, the STEM uses least likely and even if performed unintentionally, which can mislead test takers into focusing on intent rather than outcome. Liability usually arises from harm or negligence, not from following proper procedures. A cosmetologist guarantees a specific result for a chemical service. Which statement about liability is not accurate? Is it A, guaranteeing results can increase legal responsibility if the outcome is unsatisfactory? B, guaranteeing results always protects the cosmetologist from client complaints? C, a written guarantee may be used as evidence in a liability claim? Or D, verbal guarantees can also create legal obligations? The answer is B. Guaranteeing results always protects the cosmetologist from client complaints. Why this question may seem a bit tricky, the negative phrasing, not accurate, and the context of guarantees can confuse test takers. As guarantees often increase liability, but not all statements about liability are true in every case. During a busy afternoon, Maria, a licensed cosmetologist, notices her coworker using a product on a client that is not approved for professional use. What is Maria's ethical obligation in this situation? Is it A, report the incident to a supervisor or manager? B, ignore the situation to avoid conflict? C, ask the client if they are comfortable with the product? Or D, wait until the end of the day to mention it casually? The answer is A, report the incident to a supervisor or manager. Maria's ethical obligation is to address the issue, either by discussing it with her coworker or reporting it to a supervisor to protect client safety and uphold professional standards. A client requests a service that could cause harm due to a medical condition disclosed on their intake form. How should the cosmetologist proceed to avoid ethical and legal issues? Is it A, perform the service as requested to satisfy the client? B, ask the client to sign a waiver and proceed? C, explain the risks and decline to perform the service? Or D, refer the client to another salon without explanation? The answer is C, explain the risks and decline to perform the service. The cosmetologist should explain the risks and decline the service, prioritizing client safety and legal compliance over fulfilling the client's request. During a bridal consultation, a client asks the cosmetologist to use a product that is not labeled for professional use and the salon owner is present. What is the most ethical and liability-conscious response in this situation? Is it A, use the product as requested to satisfy the client? B, ask the salon owner for permission before proceeding? C, politely decline and explain the importance of using only approved professional products? Or D, ignore the request and proceed with the usual products without explanation? The answer is C, politely decline and explain the importance of using only approved professional products. The cosmetologist must prioritize client safety and professional standards by refusing to use non-professional products, even if requested by the client or observed by the owner, to avoid ethical violations and potential liability. Salon operations. Which document is essential for tracking client appointments and ensuring efficient salon scheduling? Is it A, inventory list? B, appointment book, C. payroll ledger, or D. client feedback form? The answer is B. appointment book. An appointment book is crucial for managing client bookings and maintaining an organized schedule, which helps prevent double booking and ensures smooth salon operations. Which of the following is not a recommended practice for maintaining salon sanitation at all times? Is it A. disinfecting tools after each use, B. washing hands before each client, C. only using disposable gloves for chemical services, or D. cleaning workstations between clients? The answer is C. only using disposable gloves for chemical services. Why this question may seem a bit tricky, the use of not requires careful reading, and all options may sound plausible. Only using disposable gloves for chemical services ignores other sanitation needs, making it the exception. During a busy Saturday, a client arrives 20 minutes late for her appointment and insists on receiving her full service. So how should the receptionist handle this situation to maintain salon efficiency and client satisfaction? Is it A. allow the client to wait until all other appointments are finished, B. refuse service and ask the client to leave immediately, C. provide the full service regardless of the schedule, or D. explain the time limitations and offer to reschedule or provide a shorter service? The answer is D. explain the time limitations and offer to reschedule or provide a shorter service. The receptionist should politely explain the time constraints and offer to reschedule or provide a shortened service, balancing client care with the salon's schedule. What is the primary purpose of maintaining accurate client records in a salon? Is it A. to provide personalized service and track preferences, B. to monitor employee attendance, C. to manage inventory levels, or D. to calculate salon utility expenses? The answer is A. to provide personalized service and track preferences. Accurate client records ensure personalized service, track preferences, and help follow-up, which enhances client satisfaction and loyalty. A new stylist accidentally uses the wrong disinfectant on combs after a haircut. So what should the salon manager do to address this situation and prevent future errors? Is it A. ignore the mistake since the combs were still cleaned, B. retrain the stylist on correct disinfection procedures and review protocols, C. discipline the stylist without explanation, or D. replace all salon disinfectants immediately? The answer is B. retrain the stylist on correct disinfection procedures and review protocols. The manager should provide immediate retraining on proper disinfection procedures and review protocols to ensure compliance and safety. What is the main reason for conducting regular inventory checks in a salon environment? Is it A. to increase the number of walk-in clients, B. to evaluate employee performance, C. to maintain adequate supplies and prevent shortages, or D. to reduce the need for staff meetings? The answer is C. to maintain adequate supplies and prevent shortages. Regular inventory checks help ensure that supplies are adequately stocked, prevent shortages, and allow for timely ordering. This supports smooth salon operations and helps avoid disruptions in client services. Which of the following is least likely to be considered a professional responsibility for salon staff even though it may seem important? Is it A. maintaining client confidentiality, B. decorating the salon for holidays, C. following State Board sanitation guidelines, or D. providing accurate service information? The answer is B. decorating the salon for holidays. Why this question may seem a bit tricky, all options may appear relevant to professionalism, but only some are core responsibilities. Understanding which duties are essential versus supportive can help avoid confusion on exam questions. A stylist notices that the salon's front desk is unattended while clients are waiting to check in. So, what is the most appropriate action for the stylist to take to support smooth salon operations? Is it A, politely greet the clients and inform the receptionist immediately? B, ignore the situation and continue with their current client? C, ask the clients to wait outside until the receptionist returns? Or D, direct the clients to another stylist for check-in? The answer is A, politely greet the clients and inform the receptionist immediately. In this scenario, the stylist should briefly assist at the front desk or notify the receptionist to ensure clients are greeted promptly, maintaining professionalism and efficient salon flow. Client records and risk. What is the primary reason for maintaining accurate client records in a cosmetology practice? Is it A, to increase product sales? B, to ensure client safety and continuity of care? C, to comply with advertising regulations? Or D, to track employee performance? The answer is B, to ensure client safety and continuity of care. Accurate client records are essential for ensuring client safety, tracking services and allergies, and providing consistent care. They also help protect the professional and business from liability issues. Which of the following is not an appropriate action when a client requests access to their personal records? Is it A, verifying the client's identity before releasing records? B, providing a copy of the requested records within a reasonable time frame? C, refusing to release records without providing a reason? Or D, explaining any applicable fees for copying records? The answer is C, refusing to release records without providing a reason. Why this question may seem a bit tricky. The options may all sound plausible, but only one violates privacy laws or professional standards. Denying access without legal justification is not appropriate, while verifying identity and providing copies are standard procedures. All client records must always be kept indefinitely, regardless of state regulations or business closure. Is it A, true, to ensure complete legal protection? B, true, because clients may return at any time? C, false, unless the client requests deletion? Or D, false, because retention periods are determined by state law and business policy? The answer is D, false, because retention periods are determined by state law and business policy. Why this question may seem a bit tricky. The use of always and indefinitely may mislead you into thinking this is a strict rule, but record retention requirements vary by state and circumstance. During a busy afternoon, a cosmetologist notices that a client's allergy information is missing from their record and must decide how to proceed before starting a chemical service. Is it A, pause the service and ask the client about allergies before proceeding? B, proceed with the service and update the record afterward? C, assume no allergies since none are listed? Or D, skip the allergy check to save time during busy hours? The answer is A, pause the service and ask the client about allergies before proceeding. The cosmetologist should pause and obtain the missing allergy information to prevent potential harm, demonstrating responsible risk management and client safety. A client calls the salon to request that their service history be emailed to them, but the email address they provide does not match the one on file. Is it A, immediately send the records to the new email address? B, refuse the request without explanation? C, request additional verification before sending the records? Or D, delete the client's records due to the discrepancy? The answer is C, request additional verification before sending the records. Verifying the client's identity before sending sensitive information is crucial to protect privacy and comply with data protection regulations.
Did you get a different answer? Or maybe you have a question about the exam in general? Drop it in the comments below. We read and answer them personally.
Scientific concepts. Which level of decontamination is required to destroy most bacteria and some viruses on non-porous salon surfaces? Is it A, sanitation, B, disinfection, C, sterilization, or D, antisepsis? The answer is B, disinfection. Disinfection is the process used in salons to destroy most bacteria and some viruses on non-porous surfaces. It is more effective than sanitation but does not destroy all microbial life, unlike sterilization. Which of the following statements about universal precautions is not true? Is it A, they are designed to protect both clients and professionals? B, they involve wearing gloves when exposure to blood is possible? C, they are only necessary when a client appears ill? Or D, they include proper disposal of sharp objects? The answer is C, they are only necessary when a client appears ill. Why this question may seem a bit tricky, the use of not in the question stem requires careful reading. Universal precautions apply to all clients, regardless of appearance or known health status, to prevent the spread of infection. If a disinfectant claims to kill all microorganisms, including spores, which term is being misused? Is it A, sanitizer, B, antiseptic, C, disinfectant, or D, sterilizer? The answer is D, sterilizer. Why this question may seem a bit tricky, the wording may lead you to confuse disinfection with sterilization. Only sterilization kills all microorganisms, including spores. Disinfectants do not. During a busy afternoon, a cosmetologist accidentally nicks a client's skin with scissors and notices minor bleeding. What is the correct immediate action to take according to infection control protocols? Is it A, stop the service, put on gloves, and follow the blood spill procedure? B, continue the service and clean the scissors at the end? C, ask the client if they want to continue and wipe the area with a towel? Or D, apply a bandage without gloves and resume the service? The answer is A, stop the service, put on gloves, and follow the blood spill procedure. The correct immediate action is to stop the service, put on gloves, and follow the blood spill procedure to protect both the client and professional from infection. A new salon employee is unsure how to properly disinfect reusable metal tools after a manicure service. What should the supervising cosmetologist instruct them to do? Is it A, rinse the tools with hot water and dry them with a clean towel? B, spray the tools with alcohol and place them in a drawer? C, clean with soap and water, then immerse in EPA-registered disinfectant? Or D, wipe the tools with a disposable disinfectant wipe only? The answer is C, clean with soap and water, then immerse in EPA-registered disinfectant. Reusable metal tools must be cleaned with soap and water, then fully immersed in an EPA-registered disinfectant, according to manufacturer instructions, to ensure proper infection control. What is the primary purpose of using an autoclave in a salon setting? Is it A, to remove visible debris from tools? B, to dry tools after washing? C, to sterilize tools by destroying all microorganisms? Or D, to disinfect surfaces between clients? The answer is C, to sterilize tools by destroying all microorganisms. An autoclave uses pressurized steam to sterilize tools, ensuring the destruction of all forms of microbial life, including spores, which is essential for maintaining infection control in salons. Which type of microorganism is most resistant to standard salon disinfectants? Is it A, fungi, B, bacterial spores, C. Viruses, or D. Protozoa? The answer is B. Bacterial spores. Bacterial spores are highly resistant to disinfectants commonly used in salons, which is why sterilization is necessary to destroy them. Which of the following is never necessary when cleaning reusable salon tools before disinfection? Is it A. Rinsing tools with warm water, B. Scrubbing tools with soap, C. Removing all visible debris, or D. Applying disinfectant before cleaning? The answer is D. Applying disinfectant before cleaning. Why this question may seem a bit tricky, the word never can mislead test takers to overthink. Rinsing, scrubbing, and removing debris are all essential steps, but using a disinfectant before cleaning is not required and is ineffective. Anatomy and physiology. Which layer of the skin contains the blood vessels, nerves, and hair follicles? Is it A. Epidermis, B. Dermis, C. Subcutaneous tissue, or D. Stratum corneum? The answer is B. Dermis. The dermis is the middle layer of the skin, housing blood vessels, nerves, and hair follicles. The epidermis is the outermost layer, while the subcutaneous layer lies beneath the dermis and mainly contains fat. Which of the following is not a function of the skeletal system? Is it A. Support for the body, B. Production of blood cells, C. Regulation of body temperature, or D. Protection of internal organs? The answer is C. Regulation of body temperature. Why this question may seem a bit tricky. The skeletal system has several well-known functions, but some options may sound plausible. The skeletal system provides support, protects organs, and produces blood cells, but it does not regulate body temperature. All muscles in the human body are voluntary except for which type? Is it A. Skeletal muscle, B. Smooth muscle, C. Striated muscle, or D. Biceps brachii? The answer is B. Smooth muscle. Why this question may seem a bit tricky. The word all can mislead, as only skeletal muscles are voluntary. Cardiac and smooth muscles are involuntary, but only smooth muscle is found in internal organs other than the heart. During a facial treatment, a client mentions tingling in their fingers after prolonged arm elevation. So which anatomical structure is most likely being compressed? Is it A. Radial artery, B. Deltoid muscle, C. Humerus bone, or D. Brachial plexus? The answer is D. Brachial plexus. The tingling sensation suggests nerve compression, most likely of the brachial plexus, which supplies sensation to the arm and fingers. Prolonged elevation can compress this nerve bundle. A cosmetologist notices a client's nails are spoon-shaped and pale, prompting concern about which underlying physiological condition. Is it A. Iron deficiency anemia, B. Hyperthyroidism, C. Dehydration, or D. Fungal infection? The answer is A. Iron deficiency anemia. Spoon-shaped, pale nails are often a sign of iron deficiency anemia, which affects oxygen transport in the blood and can be observed during nail analysis. Which organ is primarily responsible for filtering waste products from the blood in the human body? Is it A. Liver, B. Kidneys, C. Lungs, or D. Heart? The answer is B. Kidneys. The kidneys are the main organs that filter waste products and excess substances from the blood, forming urine for excretion. This process is essential for maintaining the body's internal balance and overall health. What is the main function of red blood cells in the circulatory system? Is it A. Defend against infection, B. Clot blood at injury sites, C. Carry oxygen to tissues, or D. Produce hormones. The answer is C. Carry oxygen to tissues. Red blood cells transport oxygen from the lungs to body tissues and carry carbon dioxide back to the lungs for exhalation. This is crucial for cellular respiration and energy production. Which of the following statements about the lymphatic system is not accurate? Is it A. It helps defend the body against infection? B. It transports lymph fluid throughout the body? C. It absorbs fats from the digestive tract? Or D. It produces red blood cells in adults? The answer is D. It produces red blood cells in adults. Why this question may seem a bit tricky. The question uses a negative phrasing, asking for the incorrect statement. The lymphatic system does not directly produce red blood cells. This is a function of bone marrow. The other statements are true. Cosmetology Chemistry. Which type of bond is primarily responsible for the strength and shape of hair in its natural state? Is it A. Hydrogen bond? B. Disulfide bond? C. Salt bond? Or D. Peptide bond? The answer is B. Disulfide bond. Disulfide bonds are strong chemical side bonds that form between sulfur atoms in the hair's cortex, giving hair its strength and shape. They are much stronger than hydrogen or salt bonds and are not easily broken by water or heat. Which of the following statements about pH and hair is not accurate? Is it A. Hair has a natural pH between 4.5 and 5.5? B. Alkaline substances can open the cuticle layer of hair? C. Acidic products swell the hair shaft and increase porosity? Or D. pH affects the effectiveness of chemical services on hair? The answer is C. Acidic products swell the hair shaft and increase porosity. Why this question may seem a bit tricky. The use of a negative phrasing, not accurate, and plausible-sounding distractors can mislead test takers. The correct answer is that acidic products do not swell the hair shaft. Alkaline products do. All of the following are characteristics of an emulsion, except: is it A. Always a clear liquid with no visible separation? B. Contains two immiscible substances? C. Requires an emulsifier to remain stable? Or D. Common in many cosmetic products? The answer is A. Always a clear liquid with no visible separation. Why this question may seem a bit tricky. The question uses an absolute and asks for an exception, which can cause confusion. Emulsions are not always clear liquids. They are mixtures of two immiscible substances. During a color correction service, Maria notices the client's hair is highly porous and absorbs color unevenly. What chemical property of the hair is most likely causing this issue? Is it A. Elasticity? B. Density? C. Texture? Or D. Porosity? The answer is D. Porosity. Porosity refers to the hair's ability to absorb moisture and chemicals. Highly porous hair absorbs color unevenly because the cuticle is raised or damaged, allowing chemicals to enter and leave the hair shaft more easily. A stylist mixes a permanent hair color with developer and applies it to a client's hair, but after processing, the color result is much lighter than expected. Which chemical process most likely caused this outcome? Is it A. Reduction? B. Oxidation? C. Neutralization? Or D. Saponification? The answer is B. Oxidation. The light result is due to excessive oxidation, where the developer's hydrogen peroxide lightened the natural pigment more than intended, overpowering the artificial color deposit. What is the primary function of surfactants in shampoos used during hair cleansing services? Is it A. To provide color to the shampoo? B. To increase the viscosity of the product? C. To emulsify oils and suspend dirt for rinsing. Or D. To neutralize the pH of the scalp. The answer is C. To emulsify oils and suspend dirt for rinsing. Surfactants in shampoos lower the surface tension of water, allowing it to spread and penetrate more easily, which helps lift and remove oils and dirt from the hair and scalp. Which of the following statements about oxidation in hair color processing is always true? Is it A. Oxidation only occurs in temporary hair color applications? B. Oxygen combines with dye precursors to develop color molecules? C. Oxidation always lightens natural hair pigment? Or D. Oxidation is not involved in any chemical texture services? The answer is B. Oxygen combines with dye precursors to develop color molecules. Why this question may seem a bit tricky, the use of always can mislead, as oxidation varies by product and process. Only the statement about oxygen combining with dye precursors to develop color is universally true. Other statements may not apply in all cases. All of the following are true about alkaline solutions in cosmetology, except: is it A. They close the hair cuticle tightly? B. They can swell the hair shaft? C. They are used in many chemical relaxers? Or D. They have a pH above 7? The answer is A. They close the hair cuticle tightly. Why this question may seem a bit tricky. The negative phrasing and inclusion of plausible but incorrect statements can mislead. Only the first option is not true. Alkaline solutions do not close the cuticle, they open it.
Thanks for watching. If you found this exam review helpful, be sure to subscribe for more real-world practice and topic-focused study videos. And visit Birdsy AI to start your free trial of Birdsy, your AI-powered study partner.